Welcome everyone to the State Retail Food Program Manager Quarterly Call. We're going to give another minute or two to some of our colleagues to jump on the call, and we'll start in just a minute.
Oh, Deanna, you're on mute.
All right, was I muted that whole time? Oh my goodness. Okay. All right, so I will start over. Welcome to the first State Retail Food Manager Call of 2023. I'm Deanna Copeland, for those of you that don't know me. I am new to the AFTO team, and I am transitioning into Elizabeth Nutt's role as the Retail Food Safety Director. And I'm super excited that you all are joining us today for my first quarterly call of 2023 and the first one with AFTO. So with that, I'm going to hand it over to Steve Mandernack, the amazing director of AFTO.
Well, as Deanna said, it's good to see all of you in 2023. Let's go ahead and move on to the next slide. We've got a handful of things that I'll visit about today and then go from there. First, I just wanted to reiterate a handful of training opportunities, letting you know where we will be announcing here in the next about 6 weeks, retail root cause analysis and environmental sampling courses for 2020, essentially for starting in October of 2023 and 2024. In addition, we're very excited. I know many of your programs did participate in the pilots of the CSIT, or the course-specific instructor training for FDA 170, which is basic inspections and investigations. We have set that to FDA for concurrence. We hope to hear back here in the near future. Once it's concurred upon, you can anticipate all us providing materials to those of you that did participate in the training, complete materials, so you can begin delivery. And for those of you that are interested, we anticipate we will do periodic offerings of that course, both virtually and in person as needed. So those options will be coming forth very quickly. Lastly, I just want to thank all of you that participated in Inspector Boot Camp. We thought it was a pretty effective means of training lots of people very quickly. We heard very good feedback. I will tell you the average rating when you asked the key questions was, 4.5 or so of 5 points, which makes me think that what we were doing was a pretty good experience for most of the participants, and we'll likely move forward with that again. So just heads up, continue with that. Power skills for regulator courses, once once again, we have one more course that's going to be offered later in what I'm going to call this federal fiscal year, and that is going to be offered in April. That course is process improvement for regulatory programs. If you are interested in that, drop Deanna and I an email, and we can get you over to the folks that are doing this. This will be the first run of that course in a full manner, so it will be in pilot form, but I think it'll be very valuable, giving you some of those skills you need for lean opportunities and do those type events and really focus on making your programs better at every opportunity. So I did hit on that. The other thing to note is when we get into the fall, we will also have some additional opportunities for instructor skills and a few other courses that we're getting ready to announce. So heads up, kind of watch for those. We expect the announcement on those to happen about midsummer, so you can start making your training plans for the next year. With that, let's move on to the next slide, Deanna. I just want to remind you all the 127th annual AFTO Educational Conference will be coming up in June 10th through the 14th in Norfolk. There is a program standards verification audit and self-assessment workshop that will predate that. Will be 2.5 days prior to the beginning of the conference. We're very excited by that workshop and that opportunity. In addition, lots of great sessions, including the whole retail track and the very, very popular tech fair is going to be coming back, the technology and innovation opportunity, which I refer to as that opportunity for a science fair for regulators, which is awesome as far as I'm concerned, is coming back. And I can tell you we're working now with many of the vendors, participants. They're not selling to us, they're showing to us, and it's not stuff that we'd be looking to buy. So let me correct that. We're working with them right now to finalize the list, but I can tell you some of them are things that if you have not seen in your jurisdiction yet, I would predict in the next 6 months you will be seeing. I just looked at one of them yesterday or the day before and really learned a great deal, but we're going to we've got several things we're bringing in that will give you some good ideas of what's out there and coming in the next number of months to your area soon. So if you haven't marked your date, please do. There is an agenda on the AFTO website under the conference. Early bird registration will be ending, I believe, April 15th, and I will double check that. I should know that by memory, but I don't recall right offhand. But early bird registration, and I'll put that in the chat here in a second when it ends. But make sure to get your reservation, make sure to get registered, and of course to take advantage of the discounted hotel rooms. I will say it's very inexpensive in Norfolk. I believe $98 a night, so that makes it a pretty easy place to go, and it has quite good flight service. So I think you'll find it's a great location. With that, I think there's one more slide, if I remember right, Deanna. Nope, I'm going to turn it over to Deanna for this slide, and thank you all and have a great meeting today.
Thank you, Steve. All right, so the next slide, of course, the Conference for Food Protection, their 2023 biennial meeting is going to be held in my hometown of Houston, Texas, and that is April. If you have not registered already or you would like to attend CFP, early registration ends, I believe, March 15th. So it's coming up pretty quick, but registration, of course, will continue all the way up until the conference starts. We look forward to seeing all of you down in Houston. You can get out of the cold, come enjoy a little bit of warm weather and eat some really good food. And on a second note, the save the dates for the issues discussions for regulators. Those were super valuable last time we had a CFP. At least they were for me. To jump on these calls and talk about how some of these issues are going to be affecting your jurisdictions and sort of discuss with some of the council members, how you feel about these issues in your jurisdiction. Those dates are going to be April 4th, 6th, 12th, and 19th. And I will be sending out those invitations probably in the next couple of weeks. We really want to get those on your calendars because CFP will announce all of the issues on March the 15th. So these dates are coming up on us really quick, and we would love to see you there. The next two items, these are more a call to you because we would love your help. APTO is seeking some information from states that have adopted more recent versions of the food code in the last 3 to 4 or maybe 5 years. What we're looking for specifically are any economic or financial impact statements that have been done, anything that may show where the economic burden lies of food code adoptions, and this can be for industry or regulatory costs. This information is going to help us augment the food code adoption toolkit so that when other jurisdictions need to do some sort of analysis, they have a basis to start with and can see how it's impacted other jurisdictions. So if you do have that information handy, it's much easier to find if you guys send it to us rather than us trying to search public record. You can email it to me or Steve Morris. His email address is down there at the bottom at apto.org. And last but not least, as part of the Retail Collaborative, the state retail surveys. Many of you recall Elizabeth Nutt setting up some calls with you to have a little dialogue and have some interview time about certain aspects of the standards and the food codes. Well, our next round of surveys are in their final stages of approval. Those are set to begin hopefully by the end of March. If not by then, they will definitely be kicking off in April and May. So be looking for me to start bugging you through some emails to get those interviews set up. And we will provide you the questions in advance just so that you have an idea of what we're going to be spending some time talking about. But I'm excited about chatting with each of you to find out more about your programs and risk-based inspections and where you're at and what you need help with. All right, so next we are going to kick things off with our first speaker of the day. I don't know if he's going to be able to sit on the whole call or not, but I'm really happy that he was able to jump on today. I'm going to introduce to you Andre Pierce. Andre is the director of the Retail Food Protection Division in the Office of State Cooperative Programs at the FDA. And today, of course, the focus of our call is all about risk control plans. So, Andre, I'm going to punt it over to you and let you talk to everyone here.
Okay, can you hear me?
Yes.
Great. First of all, AFTO, thank you so much for hosting this important topic about risk control plans. We all know their benefit, but from my own experience, it's sometimes challenging to get there with this important tool. As I've been introduced already, but on behalf of our division of retail food protection, where the retail food specialists work, I want to welcome you to the State Retail Food Protection Manager quarterly call on, again, a topic that's so effective and can be challenging to get staff and management buy-in, especially when we as program managers or local health directors are razor focused on output measures like inspections and re-inspections, things that policymakers really understand. So I really do appreciate you all being here, appreciate you hosting it. It wouldn't be FDA if I didn't look for the definition and share what a risk control plan is, so I'll share that. A risk control plan means a mutually agreed upon written plan between the candidate and the management of the establishment that describes a management system for control of foodborne illness risk factors. The plan delineates necessary records, responsible personnel, what needs to be controlled, and how it can be controlled. So it's a contract, and we come at it from a spirit of assessing the establishment and how we can practically get their resources to work for them, moving in a direction of reducing those risks in the short term, but in the long term, ultimately. So risk control plans, as I was thinking about it, they really are the foundation of an SOP and for an effective food safety management system. So I was trying to take that definition and boil it down into a way that's, easy for me to understand it. So risk control plans are really intervention strategies. They're initiatives that put in place to resolve a risk in that facility. You all know that, but I wanted to, I was thinking through that as I was thinking about these welcoming comments. And again, fundamentally, they are the development of food safety management systems. We know that strong food safety management systems correlate with reductions of risk factors at retail. And I'm looking really forward to hearing some of those examples today. I had the opportunity to have a tech check last week, and I got a preview of some of the topics, and you're really in store for some really engaging conversations today. My colleague in my own state will probably recognize this anecdote I'm about to share. I have a colleague who shared a thought that think of risk control plans as training wheels on your first bike. You know, your folks knew that you needed support, so they instituted some of those training wheels to get you going, and you were ready to ride and you were willing to get there. Risk control plans are sort of training wheels for food safety, developed by an inspector, a public health coach, and the operator, who recognize that some of the actions are needed right now to get things on track. So it's sort of like the training wheels. And as you were more and more comfortable with your bike, you were able to remove the training wheels. You incorporated those habits into the well-balanced ride that you have today, except for those who are actually getting a little older. And now, if you still ride, you have some of the systems in place to maintain your safety: maintenance of your bike, road signs, knowledge you had from previous learning. Risk control plans, just like that, have now become a foundation of the food safety management system. And when you think about it, risk control plans have all the components of the food safety management system: procedures, training, and monitoring. So without a lot of additional comment, we're in store for some great experiences and lessons learned today. You know, as I said, I heard so many, a preview of what we're going to have today. And I think Deanna, we both think that this is a very exciting program you've got lined up today. So without further ado, I will welcome you all to the group and to your meeting. And I thank AFTO again for hosting this really important session for the program managers. Thanks again for being here.
Thank you, Andre. I was hoping you wouldn't forget your training wheel analogy. I think that's just such a great segue into what we're going to be discussing today. So next, our first speaker, who's going to remain on the call as a panelist, Judy Kraling. She is the Retail Food Program Lead for the Iowa Department of Inspection and Appeals. So with that, we're going to kick it off with our talk on risk control plans and how it's done in other places and how we can do it better in our own jurisdictions. So Julie, I'll let you take over the screen share and take it away.
Okay, looks like someone is still sharing, so I'm not able to at the moment. Perfect. All right. So risk control plans. Give me just a second. Okay, so what is a risk control plan? Risk control plan is an agreement that's written by the person in charge with input from the inspector that describes the process that the facility intends to implement to correct the immediate violations and to maintain correction going forward. We look at risk control plans in Iowa as voluntary strategies, meaning the person in charge needs to be a willing participant. They need to want to change their process or behavior, but maybe just don't know how to do it. So a risk control plan can also be used as documentation if enforcement actions need to be taken with the facility. Why do we use them? So they're designed to change behavior and address long-term solutions for out-of-control risk factors. Inspectors can use them as a way to open communication with the person in charge and to offer guidance when they're unsure of their next steps. Inspectors can also use risk control plans to hold the person in charge accountable and have them realize that they and their staff are responsible for controlling the hazards and issues in their own restaurant. So when do we use them? Risk control plans can be used at any time, during routine inspections, in conjunction with on-site correction, during physical rechecks. They can be written with the operator anytime a risk factor violation exists that needs long-term correction, such as demonstration of knowledge, lack of active managerial control, multiple instances of bare hand contact with ready-to-eat foods, or other repeated risk factor violations. Successful risk control plans are written with willing operators. Inspectors need to write the risk control plans with the right person. So if the person in charge is not willing to make the changes, or if the person you're working with is not authorized to make the changes, then a risk control plan might not be the right step to take in that instance. So example, a shift manager at a corporate fast food franchise most likely can't make the call on a complete overhaul of their current procedures. Versus an owner of a local diner, they're exactly the person to implement changes, as long as they're willing. So you have to find the right person every time you're there, and someone that's willing to sit down and talk with you. So what should be addressed in a risk control plan? The risk control plan is the operator's plan for how they intend to correct the issue and ensure that it doesn't happen again in the future. The inspector needs to guide them to simple control measures that can be integrated into their daily routine. The role of the operator is to determine how they can control the immediate hazard using the facility, the equipment, and the resources that they currently have, or that they could easily obtain to ensure that future risk factor violations won't occur. The role of the inspector is to provide guidance and prompt them with questions. So what will be achieved with the risk control plan? By creating a risk control plan, the operator should realize that a problem exists in the way that they are currently doing something. And then they commit to a specific correction plan rather than just merely acknowledging that they have a violation. Other things that should be achieved with the risk control plan: operator education and awareness. They should learn how to correct not only today's violation, but future violations. Open communication between the operator and the inspector. So the operator sees the inspector as a partner. And of course, long-term action, that's the ultimate goal. So how do we follow up on a risk control plan? Our inspectors in Iowa are required to make a physical visit to the facility to verify that the processes that were detailed in the risk control plan were completed. So did the operator do what they said that they would do? The physical visit also allows for a review of any process changes that might have been implemented by the operator to ensure that the establishment is in full compliance. So why do we follow up? Following up on a risk control plan with an in-person visit shows the operator that the inspector is interested in seeing their plan succeed. It gives the operator a sense of accomplishment and allows an opportunity for questions or additional guidance from the inspector. So this is an example of a risk control plan that's ready to be completed with the operator. We built this into our inspection system, so it automatically transfers the violations from the inspection to the risk control plan. The inspector can then delete violations that they don't want to be part of the plan, or they can add additional items. The operator will receive a copy once it's completed. So it shows the items that will be addressed in their plan. It explains what the risk control plan is, and then gets into the details of the plan. Once the plan is written, the inspector prints a copy for the operator, and a copy is automatically saved in our inspection system and attached to the inspection report. So does this really work? Yes, it does. So this is an actual inspection that was conducted back in 2021. This is a locally owned restaurant that's part of a large group of restaurants owned by the same local company. The owner was not on site, but the manager had the authority to run their restaurant and make any necessary changes. Throughout the inspection, the inspector sensed a large disconnect between the front of the house and the back of the house. So the general manager was more front of the house, so wasn't really aware of what was going on in their kitchen. There were 9 risk factor violations, and the manager didn't know where to begin with the corrections. The inspector explained what a risk control plan is and asked the manager if they would like some help developing some processes to get them on the right track. And the manager said yes. So the inspector and the manager worked on a risk control plan. The inspector didn't want to overwhelm the manager, so he chose to focus the risk control plan on only one violation rather than all 9. So he chose one item that had been marked out of compliance on previous reports. He took a different approach and went through the risk control plan process with the manager, using this item as an example. He took the time and taught the manager the process of the risk control plan rather than just focusing on the corrective action for the one violation. So spending time with the manager and going through this process and placing the accountability back on them and making them think of different ways for their own restaurant to fix their own issues with the resources that they have made a huge impact on this manager. To not only make changes with this one specific risk factor, but to address everything on the report and use the problem solving process on an ongoing basis. So when the inspector came back a few weeks later for the physical recheck, the manager was excited to show him all the things that they had done since the inspection. They followed through on everything that they said they would do, and they corrected all of the other violations as well. So fast forward 1 year later, the same inspector walks into the same restaurant, the same management staff is there, the same core crew is there. The inspection isn't perfect, but they went from 9 risk factor violations down to 2. They also went from having 0 certified food protection managers on staff in 2021 to having 4 in 2022. Also in 2021, there were 4 illness complaints compared to 0 in 2022. And this wouldn't have happened if the manager wasn't willing to sit down with the inspector and write a risk control plan and learn the process for long-term corrective action for their restaurant. So this is only one example of a risk control plan success story. We do many of these each year. But the challenges that our department faces is that there's not an easy way to track the results of risk control plans. We can run reports and we can see that risk control plans were completed, but we don't have an easy way to see the actual results of the risk control plan. So we can see immediate results at the physical recheck when we go back, but the real long-term results can't be seen until the next routine inspection. And unfortunately, we don't have an easy way to track those results yet. So that's something that we're hopefully will be working on in the future. So we have ongoing training opportunities for our inspectors. One of our focus trainings in 2023, hopefully, will be on risk control plans, so they can learn new techniques and learn from each other. So we as a department can see continuous improvement in this area. One challenge that our department faces, again, is not being able to track the results of those risk control plans. And with our continuing updates in our system, we hope that that can be achieved very soon. And that's the end.
Awesome work, Julie. Thank you so much for sharing that with us. And I want to encourage all of you to take some notes throughout our presenters' presentations, because we will have an open Q&A at the end of these 3 sessions, so that you can feel free to ask any questions that you want. So if you hear something during one of these presentations that you want to know more about, take a note, because we're going to have some time at the end just for some open dialogue and questions. All right, so with that, our next speaker is Heidi, and I'm afraid I'm going to mess up her last name. Eisernhagen?
That's good. Yep.
Okay, good. She's a retail food specialist for the Alaska Department of Environmental Conservation, which I have heard they have more challenges than the rest of us do in regards to logistics. So I commend Heidi for taking some time today and being able to share what they're doing with risk control plans with us. So Heidi, take it away.
Thank you. Can you guys see my screen?
Yes.
Okay, perfect. So as Deanna mentioned, that my name is Heidi, and I am with State of Alaska Food Safety and Sanitation Program. And I'm an environmental health officer here. So the state of Alaska is responsible for the food permitting and inspections for the entire state, except for the municipality of Anchorage. We do that with approximately 18 health officers that are responsible for inspection and food establishments throughout the state. This comes into play later on. So we define a risk control plan as a concisely written agreement developed by the operator with input from the environmental health officer that describes a management system for controlling specific out of control risk factors. How our program uses these? Well, early on, they are part of our new hire training program. They're part of the beginning inspector training and curriculum, and the concepts of the risk control plan are integrated into our routine inspection work, where we are working with operators and collaboratively finding solutions to violations and problems. They're used as a tool in our progressive enforcement toolbox. So if we have repeat violations, we're able to use risk control plans. Often we use them in conjunction with office meetings. Sometimes we have operators physically come into the office to discuss ongoing issues that are noted during inspections. So we have them come in and work on developing risk control plans with them to help correct the behaviors or processes that are leading to those violations. And we can also use them as part of foodborne illness investigations. So one foodborne illness investigation that I was a part of, where we used a risk control plan, happened in August of 2021. We had a suspected foodborne illness outbreak of 67 people in the small town of Homer, Alaska. This was during COVID, and the hospital had wanted to both help out local restaurants that were struggling financially, as well as provide a sort of thank you to its staff. So they were ordering takeout from different restaurants throughout the town. So on one of those days, or the day after, we received, there were 67 employees of the hospital reported having gastrointestinal illness. Because all the employees ate similar food items, a restaurant was quickly implicated. Our program followed up with the restaurant, and epidemiology followed up with the employees. A Cubano sandwich with roasted pork and ham, as well as a broccoli salad, were the investigation targets and identified as common between all the ill employees. So during my inspection, and speaking with the operator, he noted that for the hospital order, they had done things differently than they normally would due to the large volume of food that was being produced. Normally, they cook the pork for the sandwich, and then when it's cool enough to handle, they divide it into individual sized portions, so just a few ounces, and then freeze those individual servings until they are used at a later date. For this particular order, they roasted the pork, cooled it until it was cool enough to handle, broke it into pieces, smaller chunks, and then put it in a refrigerator overnight. Assembly began the next day around 8:30, and then the sandwiches were picked up at 11 a.m. So during my inspection on site, I noted both cold holding violations for a sandwich cooler on site, as well as a cooling violation for some sausage gravy that had been made that day. So due to the nature of my visit with the foodborne illness investigation, we determined that a risk control plan would be appropriate. So I worked with the operator on developing the plan. We discussed using logs for cooling, time and temperatures, as well as cold holding temperatures, and calibration logs for the calibrating of thermometers to make sure that those temperatures that we were recording were correct. The owner would be the responsible one that was responsible for verifying the logs were completed by staff and then emailing them to me. This town is about 2 hours away from our office, so email was the best route for receiving these logs. Additionally, there was one certified food protection manager on site, but we discussed having additional training for staff, and having additional staff get the certified food protection manager training. So cooling and cold holding logs were sent to me. We didn't come up with an end date specifically in the risk control plan. There was a lot of fine tuning as the time progressed. There were no corrective actions at first on the logs. So he would send me logs and I would note temperatures that were elevated, and I would contact him immediately and say, this cooler looks like it was 46 degrees for days. And he would be like, oh no, we saw that it was elevated and we moved the food. There's no food in that cooler. And so I had to explain to him that if it's not written on the log, I don't know what's happening, and that he really needs to document everything, every corrective action. Additionally, there were some days that were incomplete where it looked like he was skipping days. But again, I contacted him and he would say, oh, we didn't cool anything that day. They only cooled a couple of items, and so they didn't do it every day. So again, I had just told him that everything needed to just be, he needed to paint a really good picture for me so that I knew exactly what was happening, even though I wasn't there. So he actually ended up doing those for quite a few months. He ended up like 4 months, I think. But eventually he got it kind of all worked out. They got a new cooler in that process too. And so we continued to do the logs just to make sure that that cooler maintained temperature as well. And then finally, we did a routine follow-up inspection and he had no violations noted. We continue to have really good communication with this operator. He was very, we had really good communication. He was very good with questions, with comments. During all of that fine tuning, we had a lot of discussions, and he was very easy to work with and very cooperative, which I think was key to the success of this particular risk control plan. As a program, what are some of the benefits that we are seeing from using risk control plans? As I noted in the earlier slide about just the size of Alaska and the number of health officers we have here, these are an excellent tool for us for communicating with operators remotely. The operators are able to demonstrate to us that they are compliant, and they're able to fix problems that may be occurring in their facilities. We've also found that just having written documentation for operators to look at is really helpful with communication. We do have some operators that their English isn't their first language, and so having it written down what the expectation is has been really helpful to help cement those requirements. And they show clear expectations as well. And then also that helps operators understand the specific requirements and critical limits that need to be attained. And it gives them the active participation. Some of the limitations that we've seen is that while they might be a good thing for things that are easily recorded, it's a little harder to use for violations that are related to hygiene, so hand washing and glove usage. And what have we found? Well, when I was looking for information for this presentation, I discovered that we don't really have any easily achievable hard data. We may mention risk control plans, but often it's in the comments of an inspection report. And so we don't have any way built in yet to retrieve when these are being used. We've been finding too that environmental health officers might be using the methods of a risk control plan, but are not consistently using the risk control plan form. And so it's been difficult to track the effectiveness of the usage of risk control plans. And so as some goals that we have for our program is that we'd like to make the form more user-friendly. We'd like to have autofill for violations, make it digital, make the language easier to understand, maybe incorporate some visual aids. And then we would like to integrate it into our management system so it's easier to track compliance, just as Julie said. And that is it.
Wow, thank you. That was a great presentation, Heidi. I really appreciate it. So I want all of you just to hang tight. We've got one more presenter before we jump into our discussions this afternoon. So next up we have Debbie Pickle. She's the Environmental Health Program Manager for the Department of Health in Tennessee. So Debbie, let's have your slides pulled up, and then we can hear about the great work that you guys are doing in Tennessee. And then, so remember, keep note, because we're going to have some Q&A after this.
Great
All
job,
right,
ladies. Thank you, Deanna. As Deanna said, I'm Debbie Pickle. I'm with the Tennessee Department of Health. I'm the environmental health program manager for the food safety program. And just want to share some things with you today. I know that the approaches that we've seen so far are a little different. And so I want to change it a little bit more. For the environmental health program in Tennessee, we have a statewide program. It's not a county rule program. We do have 5 contract counties, but they have to follow everything that the other counties across the state follow. We have 95 counties. For Tennessee Department of Health, you can see these are the retail food programs that we actually have jurisdiction over and have the authority to inspect. For our program, we have approximately 130 employees, and that is including our contract counties, which would be our metropolitan areas like Nashville and Memphis. One thing about Tennessee, our inspections are required by statute, which unfortunately, like everyone else, it's hard not to really focus on numbers, and we have to meet that at the end. But over the last several years, we've had a lot of turnover, as a lot of other industries have. A background on our program. In 2015, we implemented the 2009 food code. Back in 2013, we had started doing risk-based inspections, or trying to go from looking at the floors, walls, and ceilings to something other than that. And so we really wanted to start focusing on our risk. For our risk control plans, once we started operating and using the food code as our nexus for doing our work, part of our policy was to have a risk control plan. And of course, our risk control plans, they are geared just like what Annex 5 is. And as Andre, Julie, and Heidi had mentioned, our plans are exactly the same formatting. Our goal at that time was to have active managerial control, but we weren't sure that our staff understood what exactly that meant. And once we were getting everyone standardized under this method, we were really wondering, are we really doing a good risk-based inspection? So between 2016 and 2020, we really tried to change how we were training our EHS staff to focus more on education instead of the mentality of don't talk to me, I'll talk to you at the end of the inspection. We really wanted that interaction with the person in charge. What can we improve? Here are some questions that we had. How can we improve our management's coaching skills to enhance our staff's knowledge of risk-based inspection? And how can we get buy-in from the field and industry partners to work together? And essentially, we determined, if you're not getting it at the top, you're not going to get it at the bottom. So trying to do a top-down approach. So in 2021, when we were working on our quality assurance review, we were checking each of the field offices, which we have 8, and we were also checking the contract counties. I'm sorry, my mind went blank. And when we started looking at this, we didn't have a good way to determine whether the risk control plans were being used. Although they were supposed to be used, we weren't sure that they were being used. So what we were tracking our revocation requests and enforcement requests, And we started looking at those specifically for documentation that they had discussed a risk control plan, or that they had tried to help the operator implement one. So throughout those years, we continued to see the very same violations over and over without any changes that prevented the violation on the next inspection. So, you know, we began to question were our staff really focusing on that improvement and gaining control, or were we still focusing on scores, enforcement? You know, how could we move the needle a little for our industry partners and partner with them to get a better outcome? Unfortunately, it seemed like we had very little buy-in from our management and our staff members to use a risk control plan. So beginning in, well, here's some enforcement data that we use for dealing with as far as revocation requests. Here you can see the numbers of those submitted and the numbers of revocations we actually approved. With this, for all of the requests that did not have or have a revocation approval, what we did suggest to the manager of the field office is to go ahead and build a risk control plan with the operator, so we could start moving the needle to have better active managerial control. One of the other things that we did is we would have them increase the inspection frequency based upon repeated violations. Beginning in 2022, we had a policy change with our staff, and here you can see the details of that, but it was more of when there were repeated priority violations or an out of control risk factor was seen, that they go ahead and begin this as and being a requirement that they actually have the discussion with the operator. And we all know that it's voluntary for the operator to have a risk control plan. For us, what we were looking at is how can we get our staff to actually do it? So they were required to document on their inspection what was discussed, that they actually helped with implementing one, or that the discussion was made. It was up to the operator, of course, to go ahead and decide how they could actually correct things and work with our staff. The reaction from our environmental health staff at that point, you know, we had a lot of pushback. We had a lot of complaints from our management, and, you know, I can understand where some of those complaints and pushbacks come from. You know, they didn't have enough time, too many inspections, one more thing that they had to do. You know, it wasn't, a lot of them also thought, well, this is just a waste of time. They're not going to use it, and we'll see the same thing over and over again. But when we really started getting into that, it was presented to our person in charge and a lot of range. Here it is. Here's the form. Call if you have any questions. All the way to, we've had some that pre-write the risk control plan with no input from the operator, saying, here's your risk control plan. You have to follow this for this amount of time. Now, we have had a lot of turnover over the last several years, as I mentioned, and with low pay, we had a hard time getting a lot of the positions rehired. Fortunately, we have gone through a salary reconstruction, So hopefully we'll be able to keep more of our trained inspectors to get this done. And for all of us, across the states, we all know that change is hard, and getting this to work is, were we doing it the right way? So, how can we get buy-in, or how can you get buy-in from the industry? It's really important that we partner with the operators in the industry. We still have a lot of work to do with our staff to see that we're actually a team, and it's not us against them. Make suggestions on how the person in charge can attain control over the risk factor. Give them the support that they're needing. Keep it really simple. Don't make it something that they're having to jump through hoops to get corrected, but help them keep it simple. That way it's easy to follow. And, don't pre-write the plan for them, because as a retailer, or I'm sorry, as a regulator, we don't know what it's like in there day after day after day. So we want to be sure that we are not putting what we feel like will work in making them do that whenever it's not going to work at all. You're not going to have buy-in from them. Translate the risk control plans into different languages. Give other tools to them, logs, charts, signs, and then at the end, it all comes back to how is it going to affect the operation if enforcement actions are required to take place. Link it back to how it financially will affect their business. How, we all know that their goal is not to make anyone sick. So, link it back to some way of a public health reason for them to, to implement this and how it can help them. And it's not something that takes a long time to do, and it isn't difficult. For our results, I can't say on every inspection, but if they've had repeated violations and or out of control risk factors, this should have been noted on all of the those inspections in some form or fashion. For 2022, for just routine inspections alone, we had 46,414 routine inspections done in 2022. Unfortunately, we don't have any specific numbers currently on how many plans were developed. It is a hard data for us to be able to pull. We don't have anything on our inspection program and our inspection app that will allow them to automatically do this. It's done separately. So data it's really been a difficult challenge for us to be able to do that. But both Julie and Heidi have given me some good ideas on how we can approach it from here. Our lessons learned, I feel like that, we really had made a concentrated effort for us to get to industry and partner with them. I wish that we as the food team had rolled it out differently, which the whole thing with that comes back on me. I wish we'd given more training to our staff and maybe put that in new employee training, as Heidi was mentioning. I wish that we would have gotten more feedback from upper management on the best way to roll it out, instead of saying, here it is, you're going to do it, end of story. I think we could have had, some different ideas, and we are kind of working that a little bit better on how we can achieve this. And of course, we've seen that pre-writing plans just does not work. And it definitely doesn't work if you just hand the risk control form over to the operator without trying to help them develop that. For the future for Tennessee, and this is just since we had our pre-check here last week with everyone to make sure that we're able to share our screens with you. I've started looking at some of our revocation data for those that were requesting for 2022 and looking at the inspections that have occurred since then. And the numbers so far, none of the same priority violations were marked on these that I've looked at thus far, and their inspection overall has seen an improvement. So I'm hoping we can get more data to that here this year to share with our staff. I think one thing that I may do is require our field office managers to send in the risk control plans to us. That way we can keep a copy of those. And, you know, looking at what we have currently, do we have the metadata really to see where the improvements are other than our revocation requests? And, you know, how can we determine if there's been an improvement as far as lack of foodborne illnesses, the revocation numbers are staying the same, or other enforcement? So how can we really see if there is a change in behavior, not only with our staff, but in the industry? But that is where we are now. Oh, no. Okay, stop share. How do I stop share? There it is. Sorry about that. Thank you.
Now, that was perfect, Debbie. Thank you so much. So with that, let's see, I'm just going to share my screen again so that you have these lovely ladies' information up there, and you can remember who you're talking to if you have any questions specifically for them. We do have a little bit more to come at the end of the call once the Q&A is completed. So, all right. There we go. I hope you all can see the screen. Okay, so with that, you can raise your hand or you can put a question in the chat, either one, to let us know any questions that you may have. All right, well, I have a few questions of my own if you guys aren't going to be brave enough to jump off that pool. So let's see. So Debbie, I know you said you were still looking at how many more risk control plans you were doing, but when you increased your inspection frequency, did you expect to see an increase in plans?
For the ones that we have increased the frequency, they had already had some plans developed, and they may needed to tweak those. But because there was you know, the repeated violations, we would have, so if it was a risk 2 for us would be, you know, your complex places, the number of inspections for them would have increased to 3 times per year. I just, you know, we don't have enough data yet, Deanna, for me really to, you know, answer that question. What we're hoping is that we get better control with that 3 times per year.
Okay. And Julie, question for you. How much time does it take to do a risk control plan? And the other presenters, you can feel free to answer too.
So how much time does it take to do one? That's That's a hard question to answer because it really depends on the operator. I mean, it is their plan. And if they can come up with their solutions quickly and they've got, they know exactly how they're going to fix it and they have a plan already in their mind, they go pretty fast. If we're dealing with an operator that just does not have any idea where to even begin, then the inspector has to do a lot of coaching with them and offer suggestions and and get them on the right track. We've had, with my personal experience, I've had operators who just, they'll say something, in a grand scheme, well, we're going to change our cooling methods and we're going to go out and we're going to buy 2-inch metal pans and do all that. And when it comes down to it, the inspector has to guide them and say and tell them sometimes when they're not maybe being realistic. In the situation that I had, it was like, are you really going to go out and buy them? Let's look at what you have here. Let's look at what you currently have in your restaurant. Let's figure out what you can do with what you have. And those types of conversations take a lot longer. So it's really hard. It's really up to the operator on how long things are going to take.
All right, great. So Heidi, same question to you. I know you have a lot of travel challenges, but in doing a risk control plan through email, how much time do you feel like it's taking from staff and from the operators?
It definitely can take some time. Again, just as Julie said, like, it just depends on that operator and what they have going on and their understanding. And that particular one that I talked about with the foodborne illness, it was months of us going back and forth, and I think sometimes that's a challenge, is the time that it does take, because you really do have to follow up and make sure, that they're doing what they said they were going to do and that they understand why they're doing what they said they were going to do. So yeah, it can take some time, and it takes time over a period of time, if that makes sense. Like, it's not just like sitting down and writing the plan with them, but the follow-up and continued follow-up, if need be, can take some time. And the idea of that can be daunting, but I think overall, the time that you put into it, you really can see a reward from that.
Thank you. We've got a couple questions in the chat. So for all the panelists, do you have a state rule or a statute that allows you to increase frequency? And I'm going to assume that means inspection frequency.
I'll go ahead with that. I've already put it in the chat. We do in Tennessee, the way that our statute is written, we inspect based upon risk, and it allows us to change that if they are having issues or there's a foodborne illness outbreak. But we can also change the risk if they're doing well and inspect less frequently.
Julie, Heidi, do either of you have anything that allows you to increase frequency in your rules or statutes for your state?
We also do. Ours is similar to how Debbie explained it, where we have our risk levels and our inspection frequency that's set, but then it allows for us to increase the inspection frequency or decrease it, and update the risk level as needed. We base our risk level on the processes that they're doing in the restaurants, versus how well they do on inspections.
And we're very similar too.
Great, thank you. So there was another question here on what are the additional costs associated with these implementations? That's a good question. Everybody always has cost on their mind.
I don't know how you really can judge that other than the EHS spending more time at that location. We didn't, put any money into that other than budgeting time.
Julie, Heidi, anything you want to add to additional cost associated with risk control plan implementation?
The only other cost, I mean, we have the time it takes for the inspectors and the time that they spend on it, but also the additional cost with building it into our data system when we originally did that. But I don't know what the cost was myself. So, but I know there was a cost.
Yeah, and if it involves software inspection systems, that's a significant cost. Heidi, anything you'd like to add?
No, I'm not real sure about the what costs would be aside from what these ladies said about the time, and then yeah, if we made changes to the database.
All right, we have a comment from Kim Stryker from Alaska regarding time and just if a program is focused on a number of inspections but isn't focused on the follow-ups, you get into the mode that Debbie talked about. So as a manager, there has to be the balance. Clearly, face time is important, but doing quality work and helping the operators achieve compliance is improving public health. Great comment, Kim. Thank you. Here we have another question. In the panel's opinion, would a compliance or enforcement action work better with long-term compliance with a risk control plan and data tracking? Or do they think that compliance should be used in this type of corrective tool?
For us, when you start thinking about enforcement and compliance, of course you want to have compliance, but when it comes to enforcement, once you take that enforcement, are you going to see a change? And so for us, what we are trying to do is get that risk control plan in place prior to enforcement and any type of compliance. Of course, we want that to be corrected immediately on site. But when we have the discussion with the field office manager who is submitting the revocation request to us, we really want them to talk to their EHS and decide, if we do revoke it, are we going to be in the same situation after 3 more inspections? So we don't want to wait until then. We want to head it off before it gets to that point.
Great comments. Heidi or Julie, anything that you would like to add to the long-term compliance for enforcement versus risk control?
Well, we're similar to what Debbie said, in that we use the risk control plans as a way to help the establishment come into compliance. So the enforcement part doesn't have to happen, or at least it won't be as severe. But that being said, we document everything. So if they choose to not come into compliance, they may come up with a plan to fix their issues, but if they don't follow through with their plan and they continue to have the same violations, we have the risk control plan as documentation that we can use for the enforcement process.
Right, good point.
Oh, sorry.
Go ahead.
Oh, and then we're pretty much the same, but we use it, like I said, as a tool in our enforcement toolbox. So just like they said, that we try to use them prior to having to enforce anything. The idea behind the risk control plan really is that it's a buy-in from everybody, right? So that they're taking ownership of it and they're taking control. And when you enforce something, you sort of take that control away from them. So we definitely try to use the compliance part of that.
Good point. Good point. It's all about the control and who has that control. Which leads me to one of my next questions that I had. So when it comes to the term risk control plan, when you're presenting this to either an establishment or, you know, to staff, what are some of the misconceptions that you've heard? Or are there any that, you know, sort of put a roadblock up to getting that buy-in?
I think that there's a misconception that they're hard. I don't think they're necessarily hard, but I do think they take some time, which I guess to some people equates to hard. But yeah, I don't think they necessarily have to be difficult. But I think also in part of some of those changes that we want to implement with kind of changing our document and making them more user friendly, I think would also help to take away some of those misconceptions about the difficulties.
All right. So how are risk
Deanna,
control-
can I add something to that? I think,
Of
you know,
course.
and I know that this was covered in the inspector boot camp and the breakout sessions. I think the thing for what we see is our staff tends to talk in regulator speak. And, you know, I think if we were to approach it and train our staff to, you know, use it more like a food safety plan instead of an RCP or risk control plan. And, you know, I think that we would have more buy-in if we did it that way, and take it out of regulator talk.
What a great point. Yes. Regulator speak is so easy for us, but not always easy for everyone listening to us. All right. We had one other question. How is a risk control plan introduced to a new hire?
Julie, you want to go first?
Sure. So when we have a whole training program for our new hires, and you know, during their initial training, they may be exposed to risk control plans if they're out with another inspector who does one with a facility during their training time. But we also have a class that we teach for new inspectors, so we do that with all of them. And one of the sections is about compliance and enforcement. And we do spend a lot of time on risk control plans. And basically the whole presentation that I did is what we do during the new inspector training class. And there's exercises that are built into that where they, you know, where it's scenarios and photos and role playing that we do, and then they write a risk control plan, and then their classmates critique them. So they learn by doing and get good instruction to do them to begin with. But then going out, when they're out on their own, you know, they have to develop that skill themselves and you know, doing follow-ups with the inspectors during, you know, their QA inspections and the other joint inspections with them. We can really see if they're still doing it the way that we want them to do it.
Great ideas. Debbie, Heidi, would either of you like to weigh in on training new hires for risk control plans?
This, we just updated our new training manual, and you know, as far as for the new hires, the person that they're working with, who we call their buddy or their a direct report, their district supervisor, they would lead them on how to do those. So is it very effective across the state? You know, that's something I feel like Tennessee needs to work on. So I love the ideas that the other two ladies have, and hopefully they'll share some of their work.
For us,
Yeah.
again, very similar. It's part of our training procedures with enforcement. Also the FD 215 or 218 that that we take when we're beginning. And then also it's part of the standardization process as well. So even though they're introduced, it's introduced at the beginning, you know, when an inspector is getting a whole bunch of training on a whole bunch of different things, it is also then brought up again as they are continuing to be standardized.
Excellent. So many great ideas here. Thank you. I don't see any more in the chat, but I do have one more thing that I would like for each of you to share with our participants today, and that's going to be, just tell us, for states that are just getting started with risk control plans, what do you think the one biggest lesson learned that you would want to share with them on getting started would be?
I think for us, just in hindsight, the one thing that I would really do is look at your staff as they're your partner, and just like you would industry, and try to keep things as simple for them as you would for the industry. And I don't know that our staff felt like that we did that. So, you know, and it's regretful in hindsight, but, you know, just keep them as your partner and not as your direct report.
I would say if when getting started with them is first determine how your department or agency is going to use risk control plans. Are you going to use it as a voluntary strategy, or are you going to use it more as enforcement? And then kind of build your training program for the risk control plans for your inspectors around that premise, whatever you decide to do. And then once you're out in the field and in the restaurants, you know, we find success in risk control plans when we deal with people, when we deal with operators that are willing to sit down and talk, and those that want to do it and want to make a change. The ones that don't want to make a change and are content with how they do things, they don't work with them. And those are the times where it's frustrating for the operator, it's frustrating for the inspector, and there are very few positive results that happen when you're dealing with people who just simply don't want to do them. So that's my best advice.
Mine would just be patience. And it sounds like, I mean, we all have talked about how we could all be doing things better. So I think just trial and error, and just kind of figuring out what does work for your program and your staff, and how do you want to track this, and what do you want to get out of the data that you're going to be tracking, and what is the ultimate goal? What's your mission?
Wow. Awesome. Awesome. Thank you so much. Thank you, ladies, for your candidness, because you know, your lessons learned and tips and tricks here, these are all going to help everyone on the call, because, you know, we're all in the same race here that we're running. So before we move on to the next thing, I just want to share one quote with you that I find very meaningful as a regulator. It was meant to be a little humorous, But I had someone once give me a little magnet to put on my office door that said, "I'm not a control freak. I just want things done right." And I think that is, very much in alignment with everything that we've heard today. Not that we are trying to control every aspect of the industry operations, but we do want them to get things right, because that's when we minimize that risk and prevent foodborne illness. So thank you all for your presentations. So 2 more quick things here before we wrap up for today. So first off, I wanted to get some feedback from you guys. Now that I am graduating into this role, I need some more ideas on what do y'all want to talk about? What is what's meaningful? What's going to really help you guys in developing your programs and making things continue to track forward? Anything that you have, please, you can send me an email. You can post it here in the chat. Just keep us in mind if you think, I would really like to know how everybody else is doing that one. Send it along and we can develop one of these quarterly calls around that topic. That would be helpful for everyone here because we all have the same challenges at some point. Next up, I do want to remind everyone that afto.org, if you're looking for information on pretty much anything, check out the AFTO website. They really do have a big variety of topics, aquaculture, hemp and CBD, incubator kitchens, handouts in other languages, produce safety, so much more. There's even a new page where you can track legislation in other states right now. So if your state is gearing up for a battle with food freedom or cottage foods or CBD in foods or Delta 8, any of the other issues that we see pop up in the legislative sessions, AFTO is helping track that so that you automatically know who else is dealing with the same issues right now, and maybe y'all can pull some resources to have semi-united talking points. And last but not least, some save the dates for our coming calls. Our next call is going to be on May the 23rd. We've already got a topic for that one. And the last year, the Retail Collaborative worked on an industry brand survey. And it doesn't sound that exciting, but I will tell you the information that they gained is very exciting because it finds out how the businesses that we regulate, the major brands, how they are approaching active managerial control in their establishments. So there was a lot of great information that they uncovered, and we're going to be sharing that with you guys on our next call. But August and November, the dates are to be determined as well as the topics. So anything you guys want to discuss and put our resources together on, please send it over. And please fill out the evaluation that will be following this call today, because your feedback is only going to make these better. All right. I don't see any hands up. I don't see any new chats. So with that, you get a whole 5 minutes back in your day-to-day. And again, thank you to Heidi and Julie and Debbie. You guys were phenomenal. And Andre, of course. We are so grateful that you guys could participate today and add to all the information for our participants. So thank you very much. And we look forward to our next call. Thank you.